Hello, welcome back to my YouTube channel. Paramedic Coach. What is mean by diabetes mellitus? Diabetes is a lifelong chronic disease and is a group of metabolic disorder characterized by high levels of sugar in blood, hyperglycemia. It is caused due to deficiency of insulin or resistance to insulin or both. What are the signs and symptoms of diabetes mellitus? 1. Increased thirst. 2. Frequent urination. 3. Unexpected weight loss. 4. Increased fatigue and blurred vision. 5. Numbness and tingling, especially in your feet and hands. 6. Slow healing sores, skin itchy. 7. Red swollen gums.
What are the types of diabetes?
Type 1. Type 2. Gestational diabetes. Neonatal diabetes and MODY. Type 1. Diabetes mellitus. Type 1 diabetes is also called as the insulin-dependent diabetes mellitus, IDDM, manifests due to autoimmune damage of beta cells, which then leads to suppression or stopping of insulin production. Most patients with diabetes type 1 develop the condition before the age of 40. V cells are specialized endocrine cells located within the pancreatic islets of Langerhans, responsible for the production and release of insulin and amylin. Constituting 50 to 70% of cells in human islets, beta cells play a vital role in maintaining blood glucose levels. Risk factors for T1 diabetes mellitus. The presence of damaging immune system cells that make autoantibodies. Sometimes, family members of people with type 1 diabetes are tested for the presence of diabetes. Autoantibodies. If you have these autoantibodies, you have an increased risk of developing type 1 diabetes. But not everyone who has these autoantibodies develops type 1. Dietary factors. A number of dietary factors have been linked to an increased risk of type 1 diabetes, such as low vitamin D consumption, early exposure to cow's milk or cow's milk formula, or exposure to cereals before 4 months of age. Race. Type 1 diabetes is more common in whites than in other races. Geography. Certain countries, such as Finland and Sweden, have higher rates of type 1 diabetes.
Next is type 2 diabetes mellitus. Non-insulin dependent diabetes mellitus, NIDD. Maturity onset diabetes mellitus. There is no loss or moderate reduction in beta cell mass, 30 to 40%. Insulin in circulation is low, normal, or even high. Over 90% cases are types 2DM. The majority of people with type 2 have developed the condition because they are overweight. Type 2 generally appears later on in life, compared to type 1. Type 2 is the most common form of diabetes. In the case of insulin resistance, the body is producing the insulin, but insulin sensitivity is reduced, and it does not do the job as well as it should do. The glucose is not entering the body's cells properly. What are the risk factors for T2DM? 1. Obesity. The number 1 risk factor for type 2 diabetes is obesity. 2. Sedentary lifestyle. A sedentary lifestyle is damaging to health. 3. Unhealthy eating habit. 4. Family history and genetics. If you have a relative who had diabetes, your risk might be greater. Gestational diabetes mellitus. Gestational diabetes only happens during pregnancy. It means you have high blood sugar levels, but those levels were normal before you were pregnant. If you have it, you can still have a healthy baby with help from your doctor, and by doing simple things to manage your blood sugar, also called blood glucose. After your baby is born, gestational diabetes usually goes away. What are the causes for gestational DM? During pregnancy, the placenta, responsible for supplying oxygen and nutrients from mother to the developing baby, makes hormones that can lead to a buildup of glucose in your blood. Usually, your pancreas can make enough insulin to handle that. If not, your blood sugar levels will rise and can cause gestational diabetes. What are the risk factors? 1. Age. Women older than age 25 are at increased risk. 2. Family or personal history. 3. Weight. Being overweight before pregnancy increases your risk. For race, for reasons that aren't clear, Women who are American Indian or Asian are likely to develop gestational. What is mean by MODY? Maturity onset diabetes of the young MODY. MODY is a rare form of diabetes, which is different from both type 1 and type 2 diabetes, and runs strongly in families. MODY is caused by a mutation or change in a single gene. If a parent has this gene mutation, any child they have has a 50% chance of inheriting it from them. If a child does inherit the mutation, they will generally go on to develop MODY before they're 25, whatever their weight, lifestyle, ethnic group, etc. Neonatal diabetes mellitus. Neonatal diabetes is a form of diabetes that is diagnosed under the age of 9 months. It's a different type of diabetes than the more common type 1 diabetes, as it's not an autoimmune condition where the body has destroyed its insulin-producing cells. Thanks for watching my video. Please subscribe, like, and share my channel. Part 2 of diabetes mellitus will be releasing soon.